Hi, my name is Dr. Alex Eskander. I'm a consultant gynecologist at the Gynae Centre. And in the following 10 minutes, I'm going to explain to you what will happen when you have medical abortion by the pills. I'm going to explain how to take the pills, the side effects, what to expect, and when should you contact the doctor or me. Now, at the Gynae Centre, we always provide the doctor's telephone number for emergency. So if you have any questions, you're most welcome to ring one of us, or if none of us answer, just phone the Gynae Centre number at any time. So when you decide to have a medical abortion, you have to consider three important questions. Number one, if you're going to have the pills sent to you by post, we use a third party, and therefore you may not receive the tablets the following day unless you opt for a guaranteed second day delivery at some extra cost. In normal time, you receive them within 48 hours, but being a third party, because of COVID, sometimes because of Christmas, and sometimes because of snow, it might take 3 days, and longer is not uncommon. It happens. The best guaranteed way is that you come and collect the tablets yourself if you are in or around London. The second question you want to consider is that there is a failure rate of 3%. So every 100, 3 does not work. In spite of the bleeding, in spite of the pain, you must, in 2 weeks' time, assess yourself. Check if you are still pregnant by breast symptoms and whether you still have any nausea. But we will provide you with a pregnancy test, which you must make sure is negative, or at least it's only faint positive. I will explain about that later on. And the third point you must consider is that it is painful. So you must have a certain degree of tolerance, because the pain at best will be like bad period pain or like labor pain. So some degree of tolerance is expected. We will send you some painkillers. We advise you to buy some cocodamol over the counter before you take the tablets. This might help. Hot water bottle and tender loving care at home. If your tolerance for pain is very low, you cannot. This is not for you, and you must look into the possibility of having a surgical termination either while you're awake or under sedation, and that you can discuss with us. Okay, we'll talk about the medications. So when you get home, you will receive a box, or by post, or when you pick it up, and the box looks like that. Now the box contains 4 packets, 1, 2, 3, 4. All will be indicated, and they will have labels which tell you how to take them. Abortion happens after 2 steps. Step 1 is 1 tablet, which is called mifepristone, and this tablet you take it as soon as you receive the box. It really doesn't matter. Usually there are no side effects, but you may have some bleeding, so have a pad on just in case. Step 2 are 4 tablets which are called misoprostol. Those tablets can cause vomiting, and therefore if you take them by mouth, you may vomit them. You'll have to come back or telephone us, and we will send you tablets, which will take time and it might cost extra. So they are better inserted inside the vagina. Okay, so if you go to the toilet after you put them in the vagina, they might fall out. So make sure you go to the toilet beforehand, after 36 to 48 hours. You may take them after 24 hours, but only if you are over 6 weeks pregnant. So my advice is that stick to the 36 hours rule. Skip the following day after taking the first tablets, and then the day after, put the 4 tablets inside the vagina. And how to do it? After you've gone to the toilet, you lie down in bed, you open the 4 tablets in one hand, You hold one tablet at a time while you are in bed, and you insert it all finger inside, that you are sure it is high in the vagina, not outside. You repeat the 4 tablets at the same time. Lie down for about 10-15 minutes so that they stick a little bit. And then you get up, and as soon as you get up, you take the painkillers. So we have enclosed diclofenac tablets, which you can use for your periods as a way. They're good analgesics. And you take 2 tablets orally, and if you got cocodamol or even paracetamol, take 1 or 2 tablets depending on your weight and size. So if you are big, take 2 tablets. If you are petite, 1 tablet may be enough. You wait 3 to 4 hours. Most of the time, some cramps, some bleeding, and that means it's working, and it's fine. If this happens, you don't have to do anything else. Usually you progress into a miscarriage, and it depends on what stage of pregnancy. If it's too early, under 6 weeks, it may be just spotting. But if it's over 6 weeks, it will be like a period. It may be heavier if you are over 8 weeks. Now, suppose nothing happens after 3 to 4 hours. No cramps, no bleeding. We have also enclosed 2 additional tablets similar to the 4 tablets. And those 2 tablets you put also inside the vagina after 3 hours if no bleeding happens. If you are in doubt, wait a couple of hours. It will just, the whole idea is that to kickstart the 4 tablets to start, and if they're not working, you put 2 more tablets. I hope this is clear. You are going to receive full instructions inside the packet, and the doctor would have sent you some indication by email after the end of the consultation. Now, side effects to the 4 tablets. Nausea, vomiting, diarrhea, or fever. So if you have a temperature over 38, 38.5, it's not unusual, it's normal, it's not due to COVID, and it is due to the misoprostol. Don't worry, you've already taken paracetamol and it should get better soon. Okay, now, how would you know it's been successful? So number 1, you check that you're no longer feeling pregnant, no more breast tenderness, and no more nausea, or becoming less at least after 1 week. 2 weeks later, there is a special pregnancy test with a pot with some instructions how to make it in the back. So this test has 2 windows. I'm going to open it up to show you the 2 windows. Here we are. So you put drops of urine as per instructions inside each post, and the top pot, as you can see, is written number 5, and that means it tests the pregnancy hormone at a very low level of 5 units. The lower one has 1000, which means it tests at a much higher level. So we expect some pregnancy hormone 2 weeks later. So you might have 2 lines here. Usually it's not very strong, but even if it's strong, it really doesn't matter. That is normal to have 2 lines. Whereas the 1000 should be negative or maybe faint positive. If you have a strong positive 2 lines, it means you're still pregnant and you urgently need a scan to decide what to do. But if it's faint positive, all what it means is maybe there is some retained tissue. And what can you do? So obviously you're a little bit worried. If you decided to come and have a scan to check, there's an extra charge for the scan. But what you can do is buy a normal commercial test from Boots or anywhere else and check it after 2 weeks. If the commercial test is negative, you're no longer pregnant. But if it's positive in any way, faint or not, you should arrange a scan, either with us or at your local pregnancy unit in your local hospital if you're not in London. I hope this is clear. Now we talk about when should you consider going to hospital? Now remember, if you haven't had an internal scan or an ultrasound at the clinic to confirm that the pregnancy is inside the uterus, here, you should always consider the possibility it may be outside in the tube. And a pregnancy in the tube is called an ectopic pregnancy, and quite often it doesn't grow after 6 weeks. It just really causes the tube to open up and you have trickle of blood inside the tummy, i.e. intra-abdominal bleeding. Obviously, continuous bleeding into the tummy is serious. It has to be stopped and you have to go to hospital as soon as you have any symptoms or signs of ectopic. So what are the symptoms of ectopic? Ectopic, as soon as the blood accumulates, you will feel that the pain is above the belly button. You might feel pain in the shoulder, and if you feel dizzy or faint, that means there is already about 1 liter of blood inside the tummy. Call the hospital, call the ambulance, or make your way to the hospital if you can recognize this earlier. And you've got the number of the doctor or the clinic. You can call us anytime if you are in doubt about anything. Okay, I hope it all goes nice and smooth for you, and you should expect the bleeding really to last anything between 1 to 2 weeks on average, but bleeding up to 4 weeks is not uncommon. Providing it's not too much, it's not affecting your health, it's okay. It means that there is some clearance from the uterus. It's very good to talk to you, and I hope you have a comfortable procedure and have a normal period about 6 weeks later. Goodbye.